We'll get back to your calls in just a bit. But our guest this hour is medical expert Dr. Mark Anderson. Good morning, Dr. Anderson.
Good morning.
Wanted to talk to you a little bit about what's going on here in San Francisco. The city attorney, the New York State Attorney General have joined forces. They're investigating whether Monster, the beverage corporation, is marketing its highly caffeinated drinks to children. Now, this probe started last month before a federal judge in California tossed out a lawsuit filed by Monster, who was actually trying to stop the city attorney, Dennis Herrera, from investigating. He's filed a lawsuit claiming the drinks pose health risks, and they're accusing this company of violating state law by misbranding its drinks and marketing them to minors. Are these drinks bad for kids?
Well, the Monster 16-ounce has 330 milligrams of caffeine, and that amount of caffeine is bad for, say, smaller children, even teenagers. So it's not a healthy drink from the drink, but there's a lot of other things out there on the shelf that aren't healthy either that haven't been pursued.
Well, that's the thing, and that's the other thing I'm looking at. You know, this is the same. This has the same amount as like a McDonald's iced coffee, and nobody's out suing McDonald's over their iced coffees or trying to get them to stop them from selling them to kids. But I guess the case here is they're marketing them towards kids.
Well, from what I understand, I mean, they do place them in schools, and they do have some marketing materials that might be targeted, and so that might be, that's one for the law to decide whether that's inappropriate to market it. But as far as medically, is it excessive amounts of caffeine? A soda, an average soda has 50, 55 milligrams of caffeine in it. For an older kid, one soda a day is not going to tip them over and have any medical consequences. But you start getting up in that 330 milligrams, that's a lot. But it's no more than my Starbucks every morning.
Yeah, of course you're older and your body weight and everything else. But what's going on? Because I talked about it earlier, where when I was a kid, and obviously Starbucks weren't on every single corner when I was a kid, and I don't give my kids any caffeine at all. That's a decision. Caffeine's a drug. It's a stimulant, in my opinion. It's the most popular drug in the world, actually. But they can make that decision when they turn 18. What's going on, though? I walk into a Starbucks and I see kids that are 11, 12, 13, and they're ordering these giant frappuccinos and these giant mochas. And I'm sitting there thinking, obviously Starbucks weren't around when I was a kid, but I wasn't having a cup of coffee every morning at that age. What the heck's going on?
Well, I see, same when I go in, and you see the kids coming in there before school, and it's not new. I mean, kids did sodas before. I mean, that's been around going back decades that they do sodas, and I think probably even, I remember my grandfather used to say that he'd get up when he was a kid and have a cup of coffee with his parents. So it's not a new thing, but it is targeting more of the kids, or it's becoming more popular.
So take us through, what we should know as parents. Should our kids be having any caffeine at all? Is there an acceptable amount that they can have versus their body weight and age?
Well, I think a child that's over 6, 8 years old, one soda a day that has that 50, 55 milligrams early in the day, you don't obviously give it to them right before bedtime. That's not an excessive amount. That's not going to cause, heart racing and side effects. When they start doing a couple of these energy drinks or things like that, that can become excessive amounts. Even for adult patients, it can become amount. So with my adults, I tell them if they're measuring their coffee in cups a day, they're probably fine. If they're measuring it in pots per day, then they probably need to cut back.
Yeah. The FDA is investigating whether or not these Monster energy drinks have been linked to death, but the agency notes that the reports don't prove the drinks cause the deaths. Would one of these medically be able to cause a death?
Well, there have been cases. I mean, I've had, with stimulants, not specifically caffeine, but in the years back, I had a patient that suffered a stroke from taking, diet medication, which oftentimes has caffeine and stimulants in it. So in certain persons that have high blood pressure or medical risk, any type of stimulant can be dangerous and needs to be monitored.
Yeah. 415-808-0810 is the number. Let's go to Stella standing by on line one. How you doing, Stella?
Hi. Listen, I'm a first-time caller. I just wanted to make a comment about those Monster drinks.
Sure.
There is this young man they found dead, and he used to drink 5 a day, and they attributed him dying because his heart gave out. And he did. I mean, everybody knew 5 a day. That's a lot of caffeine and a lot of sugar. And I don't know how the FDA doesn't stop this.
Doctor, do you think the FDA needs to stop this? Do you think the FDA needs to look at this and maybe put a limit on how many you should drink, or whether or not they should cut down on the amount of caffeine in these drinks?
Well, I think it'd be along the lines of, like what they do with the tobacco products. If they could require a warning label on it saying that if you have high blood pressure or medical conditions, check with your doctor first. But I don't think that they're going to get in the business of regulating. It's, ironic that in New York they tried to limit the size of the drink that someone could get along the same lines, keep it 24 ounces or less of a soda. And, that got knocked down. So it's a bit of hypocrisy that when we try to limit it on one end, it gets knocked down, but if it's some particular brand, it's okay.
Yeah. I'm on the caffeineinformer.com website right now, and I'm looking at these. I mean, if you start cracking down on Monster, I mean, good Lord, there's 5-Hour Energy, there's a 5-Alarm Energy Shot, there's 5150 juice. That has 500 milligrams of caffeine in it. I mean, the numbers are just endless here. You would have to go down the line and just crack down on all of these, wouldn't you?
Well, you would. I mean, or have a general guideline that said that a product was limited to so much caffeine per dose or per unit.
What about, let's kind of switch gears here and talk a little bit about what they call the Alco Pops. These are the energy drinks that also have alcohol in them. Now, a lot of stores in my area, they started moving those out of the, they were placed a little too close to the soda aisle. So they started moving them away from those and more into the alcohol section. But what kind of damage can those do to, let's say, an adult, if an adult consumes like 3 or 4 of those?
Well, you've got multiple drugs going on in that case. So, I mean, it's kind of like the substance abuser that's taking uppers and downers. So you've got amphetamine or the speed-like amphetamine effect with the caffeine stimulants, and then you've got depressants with the alcohol. And we've always known that taking those in combination, it can pose a risk.
Yeah. Okay. Doctor, we appreciate your time here. Dr. Mark Anderson, we are up against the clock. Thank you very much.
Thank you.